Morning.
Good morning. Hopefully we have a good turnout. morning. Good morning. We'll get started momentarily.
All right. Kevin is joining us right now.
Okay.
I clicked the Teams link and was sitting there for a bit and then realized what I did. So
No worries.
switched over.
Give folks about 2 more minutes to come in, and then we'll start.
Okay. I think Kevin is on now, but I can't hear him. I'm not sure if he's muted. Let's see.
No worries. I'll look for him and make sure
Okay.
he's
Great. Thank you.
no problem. I don't see his name yet popping up.
Let's see. Oh, yeah. Hold on. Here's calling me.
Damon, it's Kevin Pierce. He's listed as an attendee.
Okay, I see him now.
Okay.
Okay, soon as there he is. Okay, so we can go ahead and get started. So good morning to everyone. Welcome. My name is Damon Hoyle. I am Senior Operations Project Manager here at Texas Education Agency. And I'm joined by my colleagues at DSHS, which is the Texas Department of State Health Services. And that's who TEA and DSHS, we collaborate with each other to provide COVID-19 testing, services, and other mitigation allowable costs and options for public and private schools across the state under what's called the Reopening Schools Grant, which is going to be continued for the 2022-2023 school year, which is a great announcement, great news for our schools. And so the K-12 COVID-19 testing program falls within that grant. And so we're excited today to be joined by Goodside Health, one of our vendors, our partners. They joined us in January and have been doing an excellent job with providing COVID tests to schools. I'm going to turn it over to you all in just a second. We got 2 other things I want to say really quickly. This webinar is intended for the attendees, public and private schools, to ask questions, to learn about what Goodside will be offering next year for any tweaks or changes, and then things that will continue. This is also a great opportunity for all those who are attending to ask questions. We will have a Q&A session at the end, so please drop your questions throughout here in the Q&A feature or in the chat feature. We're going to make sure that we try to get to all of those questions. This session is also being recorded. So by the end of the week, we will post on the TEA website a recording of this session, along with any PowerPoint presentation or materials Goodside provides. So with that said, I will turn it over to Ms. Cicely or Mr. Kevin at Goodside.
Thank you, and good morning, everyone. We will go ahead and get our PowerPoint pulled up, but hope everybody's doing well and enjoying your summer. If you can give us 1 second, I'll share my screen and we'll walk through our program. And it's not letting me share the presentation, so it's telling me that the host has to allow me the opportunity to.
Yep, I got you.
Okay, thank you.
No problem. You should be able to do it now.
All right, here we go. And can everyone see the screen?
Yep, we're good. We can see.
Okay, let me put it into presentation mode. Okay. Is everybody able to see this now?
Yes, sir, we can see.
Yes.
Okay, great. Well, I'll get us started. Again, thanks for joining. We've really enjoyed our participation in this program and having the opportunity to safely reopen schools. It's really core to our mission as a company. And so we're really thankful to be part of the process and a vendor partner to so many districts across Texas. I like to start by just kind of outlining a little bit about us and who we are, and then eventually who we are not. I think it just helps kind of frame the program and frame the decisions that are upcoming for the district. So super high level, Goodside Health. Our core business is delivering health services into schools. We are the nation's leading provider of health services in schools. And we built our program really on the back of an infrastructure that had already been deployed across Texas, which really allowed us a unique opportunity to utilize our background in healthcare and integrate that with our deep subject matter expertise in schools, and eventually to deliver healthcare in over 1,500 schools just here in Texas alone. And so the core of our business on a day-to-day basis outside of DSHS is really just that, is meeting kids where they are, meeting employees of the district where they are, and that's in school, 180 days a year, 8 hours a day. And we serve districts of all shapes and sizes, from small rural districts all the way up to the largest urban districts in Texas. And so really our ability and our experience to deliver healthcare first and foremost has given us a unique perspective on building programs like this DSHS program, because we're so familiar with delivering healthcare in communities across Texas. And we've done that for over 10 years now in a variety of different fashions. Actually, the start of the business was through your typical brick and mortar clinics that we have now scattered throughout the state that serve our communities in Texas. And again, in schools. And then as we've evolved over the last few years, we've gotten to be experts in remote congregate testing in a number of different environments. And then we've leveraged digital health and virtual health to expand our service offering in a number of different ways. But at the end of the day, I always like to say our DNA is we are a healthcare provider. We're a healthcare provider that has been here for quite some time in Texas. And it's that infrastructure and that DNA that has allowed us to really deliver so many meaningful programs across the state. And as we kind of flow through this presentation, one thing that is really core to our company as well in this DSHS program and throughout is our commitment to customer service, right? We're extremely focused on our clients. And whether that be in a clinic or whether that be in a school, whether that be a virtual connectivity, we believe it's very important to be user-friendly, to provide very low friction engagement opportunities, and to be responsive to the needs of the patients that we're serving. So that's a little bit of background on Goodside Health. I mentioned we're based in Texas. We actually have a few offices throughout the state. So we've got a corporate team in addition to the clinical team that is actually, sitting here. I'm coming to you from Austin, Texas today, and we've got team members all throughout the state. We were built here, and we continue to plan to focus our efforts on delivering healthcare in schools in Texas. So let me tell you a little bit
real
about,
quick, Kevin, sorry to interrupt. If you can, we see your notes from the next slide. So if you could just, someone drop the thing if you could, we just want to see the main slide. One of the.
Yeah, let me see if I can It looks like a formatting thing. Hold on one second.
Yeah, no
Maybe it's
problem.
displaying. Mm. Let's see.
Are you working from two screens?
Let me try real quick another.
Yeah.
I wasn't. I have to. Yeah, I was in presentation mode, so maybe there's another way to do it. Give me 1 second, and I'll try to reboot it and
No
do it in a way that
worries.
it isn't showing two screens for you.
Yeah.
Yeah, it was just previewing the next slide, huh?
Yes, sir. And one of the attendees made a note of it, so I just wanted to make sure because
Okay.
Next slide. No worries.
Let's see. Let me try to share again, and this may be a slightly different format, but y'all tell me if you like it better. Can you guys see it now?
Yes.
Yes.
Okay. I mean, it's obviously got the toggle over here, but I feel like if I go back to presentation mode, it's going to show that next slide. So is this better? Is
Yeah,
this an
we can
easier
work with
way to
this.
see it?
Yeah, this works.
Okay, does this work? Okay,
Yes, sir.
so a little bit kind of about who we're not. You know, I think COVID has generated a lot of new opportunities for businesses and to kind of dive into healthcare, and then folks even from within the healthcare ecosystem to try to expand out of their kind of normal healthcare service delivery systems. And so I think it's, you know, as we walk through this, I just like to be really clear about who we are and who we're not. I think it's important. We get asked this a ton. What all the parties, all the parties that are involved to deliver testing in schools. And so, you know, just want to be really kind of clear that we're not a lab, right? We're not a lab that is, you know, has historically has either, you know, come to be in the last couple of years with COVID or has been historically a lab and is expanding out to deliver healthcare. Again, we're a healthcare provider. Certainly, we have 10 plus years of experience doing rapid and PCR type testing within facilities and communities. We definitely utilize lab services and partners when we need to, specifically in this scenario for PCR testing. But at the core of who we are, we're healthcare professionals. We're not a lab that's kind of getting in to deliver healthcare services. We're not a staffing company. We, for the most part, all of our team members are really W-2 employees of ours. They work for the company. This is one program that they obviously are focused on, but ultimately we provide a number of different pathways for their career, and that allows us to retain good folks and for our attendance on site at schools to be much higher because they're actually our employees, right? We're not leveraging partnerships that sometimes introduce third parties and can fragment the situation. And so, you know, as you look at, you know, from a staffing perspective and now moving to the technology, how do you actually engage with us and how do we deliver this care? We've actually, everything that we've built from a technology perspective for the platform that the schools and the families and our team members use, it's all homegrown. We've got a technology team under this roof. We're not leveraging third-party applications that, again, also introduce opportunities for different customer service numbers, different lines, when a district team member may be looking for some help. We've got one point of contact. Actually, Cicely on this call is your primary point of contact. And we were able to react and adapt and build things that make sense for our district partners without having to lean on third parties, whether it be technology or staffing. And again, we're not a company that has seen COVID arise and thought what a great opportunity to dive in. We were here long before COVID, and that has helped us really build an infrastructure that is really kind of unique in this state and puts us in a we believe a very unique position to help best serve the districts across the state of Texas. Because before COVID, we were doing rapid testing in schools, think strep and flu and other testing. And so we had programs and workflows and technology and trained team members out there doing testing already before COVID ever came to be. So for us, COVID was really just adding a new test and a new service rather than creating an entire new business and platform. And so as we kind of walk through, the COVID experience for everybody, I think schools, healthcare providers, everybody has really been having to adapt to this new environment. And COVID has thrown a lot of curveballs, but a few things about our experience that kind of sets us apart a little bit. Again, we are delivering and have been delivering testing in so many different ways for so long. When COVID hit, I think within 7 days, we were actually already out in communities in Texas delivering congregate testing. So not just schools, but obviously schools were one of our main partners. So we were out throughout communities across the state delivering testing. We've since, outside of K through 12, where we do touch about 1,500 schools, we've delivered testing and been the testing partners for the Olympics, Big 12 Conference, American Athletic Conference, College Football Playoff Committee, and bowl games, many colleges and universities across the United States, large employers, and then oftentimes communities in need. We've done a number of kind of, I'd call creative testing solutions that had communities that were either spiking and just didn't have the resources, especially early on in COVID. And so why is that important? That's important because we've seen so many different scenarios, and all the way back from a week within this thing being declared a pandemic, we were in the field on the front line delivering testing and delivering healthcare. And that's allowed us to really iterate on our process and adapt so quickly. And one of those, internally, one of the things that's really helped us customize our program in schools is our subject matter expertise in K through 12 health services. We have multiple team members on our team, on our leadership team, that are ex-directors of health service in major school districts in Texas. They understand schools. They've helped us build these solutions, looking at this thing from the four walls of a school and a community out, right? Instead of trying to medicalize schools, we've taken the approach of let's understand how schools exist and build solutions that work for them and the communities. And so it's that, kind of diverse experience that has allowed us to improve so quickly, and really make this a turnkey solution and a very low friction solution for our district partners. We're able to understand their needs, adapt to those needs in an expeditious manner, because we can change our own technology, we can add our own staff, and we can make adjustments very, very quickly. So as we move on here, what are some of the key reasons that you would want to choose Goodside Health as your testing partner? I've mentioned a few of them already, so I won't keep reiterating it, but we have extensive experience in schools in Texas. We have extensive experience in healthcare. We don't require any kind of third-party partnerships, whether it be staffing or technology, to deliver this solution. And we're really able to, again, understand the needs of our district partners and form a program that fits those needs much quicker than most. And we're in Texas, right? We're not a company that's not located here, that's deploying resources, or that's part of a national, GPO that just happens to be able to deliver these services. We're here, we're based in Texas, and we have a significant infrastructure across the entire state that really allows us to leverage local resources and deploy those for improved service and outcomes in an expeditious manner, just because we've got team members in the field. And the last thing I'll point out, again, because we have a diversified healthcare offering across the state of Texas, and very early on, we were doing a significant amount of COVID testing. We were able to utilize existing manufacturer relationships with, Quidel and Abbott and some of the tests that you'll see here later on, and really secure a pipeline of supply. And that has served us and our partners extremely well. There's been a lot of volatility in testing, tests that have gone on back order and come back, and we've, for the most part, we've been able to maintain our supply and not have any disruptions with our partners due to a lack of testing supply in the macro level market. So speaking of tests, let's talk through for a second some of the tests that we provide and the pricing. I believe many of you are aware, but these are also posted online. And so if anything that we say today you want to reference later, both this presentation and the vendor resource chart has this information, but it's still very important to go through. So from a rapid antigen test, we do see most frequently our school district partners requesting rapid antigen just by the nature of the resulting. So you'll see in the top left corner of this chart, all of our rapid antigen tests are resulted within 15 minutes or less. And again, if we're offering Quidel QuickView or Abbott BinaxNOW now, our resulting time is going to be no different than anyone else offering those tests. Those are resulting times of the tests themselves. But we do have, again, very strong partnerships with Quidel and Abbott, both on the Quidel QuickView, which is a $19 rapid test, which comes in a box of 25, so that is the minimum order, and with Abbott, which is also a $19 BinaxNOW test, and the minimum order on that one is 40 tests. We do also have the ability to provide GenBody rapid antigen test. And then the last one that I'll mention is the Quidel Sophia. So this was actually the predecessor to the QuickView from a testing perspective. It requires an analyzer, which is just a small unit that you actually run the test through. Primary difference between the Sophia, the Quidel Sophia, and the Quidel QuickView is that analyzer. The analyzer does read the results for you. So that part is a little bit different than someone having to read the results from one of those rapid tests like a QuickView, BinaxNOW, or GenBody. That's a primary difference. But again, it does require an analyzer, and there is a cost associated with that analyzer. They're $1,200 per unit. We've deployed those successfully as well, especially early stages in COVID. And then on the PCR side, again, similar test to what you'll see from a number of other vendors, but the TaqPath combo, which is $105 per test, and the minimum order there is 150 tests. Moving on to our staffing. So on-site staffing is something that we offer as a part of this program. Our on-site staff can conduct the antigen test, really can runs the whole program for the school district. It becomes a turnkey solution at that point when our staff is on site, because our staff does conduct the antigen test. They will obtain the specimens necessary for PCR as well, if that is the test that a district chooses to use or would like to utilize. And so the pricing for our staffing is $95 per hour per staff member.
Sorry, could you say that again?
Siri's talking to me. $95 per hour per staff member. And again, I'll just mention that we're a little unique in our staffing in that we have a pretty significant infrastructure of team members that exist on our team currently that are throughout the state. It does allow us to react pretty quickly to the staffing request of our district partners. And then the last thing I'll mention, and we'll get into it here in a little bit later in the presentation, is we're very transparent and upfront with our scheduling. We provide visibility to our district partners on who our staff members that are scheduled will be on site. And that's important. And I'm sure some of you who were part of the program this last semester have run into this. People will get sick, things will happen. And so it's very important that a district partner, as well as your testing partner, is aware of who should be showing up, what's the scenario, so that we can react quickly. And so we do provide a lot of visibility. And again, back to a single point of contact. If there are any issues, you're not calling a third-party company to get in touch with who you actually have a contract with to deploy testing. You're calling one source, and we control the staffing as well. So moving on to the technology real quick, I've alluded to it a few times, but we've got a proprietary technology platform that we have built specifically for schools, that we've built, that we've customized specifically for DSHS, not for other states, not for other testing programs. Our technology that district partners will be using in the fall is specifically designed for this testing program. And why is that important? Because it's extremely user-friendly, right? Everything from consenting all the way through the resulting process is intuitive, it's user-friendly. It does not require a lot of learning or third-party applications. And it's seamless and on demand. So if we need to add a new patient to receive a test, it's on demand, it happens in the moment, and everything to the maximum of our abilities is is seamless and automated, right? So we're taking as much work off of the district partners and even our staff in the field as possible so that they can focus on academics for our district partners and for our staff on site, they can focus on delivering good healthcare and not have to worry about the technology process. We do have some abilities to customize that to specific district needs. I know we've seen a lot of districts across the state that we partner with in DSHS that have different programs. So multiple sites going on at the same time, different hours, some sites that want to be drive-through and other sites that don't want to be drive-through. So we have the ability to really look at the needs of the district and bend the technology and frame it in a way that works for their needs. So just a couple of lessons learned. Many of you that have participated in the DSHS testing program probably saw these two things. Everyone's end goal here is to deliver the best possible healthcare in the communities and keep these kids safe and team members on the district side safe and in the four walls of the school. Now there are certain requirements of the program of the districts from the program, and that's regardless of whatever vendor you're using and have partnered with. These are just requirements that are built into the program, and that is, districts have to confirm with DSHS the receipt of tests. So once you order tests and we ship them out, or any vendor ships them out, the district has to confirm receipt. And then once they have those tests and they're being utilized on patients in the field, they have to report that back to DSHS, right? We have to say, we've shipped you 100 tests and now you guys are using 100 tests along the way. You've got to log those. Now, this was a point of friction that we saw from our district partners, and we actually picked up some district partners that were having some issues with this very thing. And so what have we done? We've taken a look at that very specific challenge of the requirement of the districts here, and we've iterated on our technology so that we can automate this as much as possible. We're not asking districts to do really anything more than use it, right? If you are using the system, if you're logged in, then those tests will automatically be tracked in our system, and it won't require any reporting from the district back to state. It'll all be captured in our system and automatically sent to DSHS in a way that very specifically fits the request of the program. So it's again very user friendly from that perspective. Another thing that again is a district requirement, not specific to us, for any vendor if you have staffing on site, and that is the district have to confirm the staff that has showed up, right? And so back to the scheduling, visibility, and having our own team members. This is why we believe it is extremely important to be transparent with our district partners and to have that direct line of communication. We provide schedule visibility. We're typically speaking able to maintain the same staff members throughout the program. So in other words, if we establish a program while we're making it visible on a weekly basis, the reality is our goal is for those same team members to stay on site throughout the perpetuity of that partnership, not just for that week and skip a week or two here and there, which is what we have seen a lot of, a lot of 1099 third parties that will pick up hours and bounce around. Well, that does provide a lot of opportunity for failure, for people not to show up for work, and a lot of work actually that ends up on the plates of our district partners. And so again, that we believe that it's that our system here allows or results in a much lower friction point here with regard to staffing. We're able to maintain our staffing because we do provide a career path, not just hours for them to pick up. And again, we've got a Texas infrastructure that when issues do arise, because they will, regardless of whatever vendor it is, people will get sick, people will have life hit them, and things will happen, right? And so the ability to adapt quickly and replace that team member who can't show up for work that day or that week for whatever reason is vital, because the community in need of testing, they while that person has something going on, they need someone there. And so having that national or that statewide infrastructure allows us to move resources around when those situations do arise and do it in a very, very quick manner. Okay, so what are the partnership options with Goodside Health? There are really two primary options. with us and really a number of others, which is you can purchase the tests for yourself, for the district to administer without our staff participating. So that's option one, which is just purchasing the test. We've got an email address there, which is the best way to request those tests, and that is testing@goodsidehealth.com. And so the district testing coordinator will initiate contact with us via that email to make a request to purchase tests. And in this scenario, when you're just purchasing tests, we provide our turnkey technology platform and testing process, which includes things like the test kit itself, the user-friendly technology platform, which I've talked about, which handles all the consenting through the resulting within the single platform, as well as training and then ongoing support. Again, we're always available and ready to help. Even if we're not deploying our staff on site, we're happy to help our district partners. We're just trying who just may have questions about the test or just may have questions about the technology or whatever it may be. We do have a rapid response there. So that's option one. Option two would be purchase the test as well as the staffing, and that's when it becomes a real turnkey solution for the districts, and removes, it really pulls that program outside of the district's purview from a health perspective, and it puts it on our plate. Testing@goodsidehealth.com is how you would initiate the request for option two, which is purchasing the test and the staffing, and then we handle everything else from there outside of the requirements of the district, which we just touched on just a second ago. There are certain requirements of the district, but outside of those very specific requirements, it really becomes a hands-off turnkey scenario in those situations. So those are the two options to partner with Goodside and how to get in touch with us. Before we open it up for questions that you all may have, we tried to attack just a few FAQs that we're seeing. How do we get started with Goodside Health is one that we got on our last webinar. Again, I just touched on it, but emailing us is the best way to initiate the request, testing@goodsidehealth.com. And then how quickly will you receive the test once you place the order? We have a supply, we have current supply throughout the state that allows us to distribute the test very, very quickly. So we put 2 to 3 business days. The reality is if we dot all the I's and cross all the T's on the first day, if you make a request at 9 in the morning, there's a strong chance that we're shipping it out that day. So we have the supply, we have the capability to deploy quickly. Again, we put 2 to 3 business days because every situation is different. We do sometimes get incomplete requests and we don't have everything we need. So just kind of an average time frame there. And then if we want Goodside Health to run testing for our district, how quickly can you start? So this now touches a little bit on the staffing piece as well, not just deploying the test, but how quickly can we actually get out in the field and doing this? And again, we move pretty quickly. We've put here that we aim to kind of be testing in the field within 10 business days. Again, oftentimes it's very situational, but oftentimes we can do it faster than that. It depends on a number of factors, many of which are just getting all of the necessary information on the front end, right? It's very important that when we start the communication, that we get all the necessary information, because that allows us to start deploying resources behind the scenes much quicker. So the next steps are really, what we've already touched on. So I'll pause and stop sharing for a moment and open the floor up for some Q&A. So if you guys have some in the chat or want to help us run the Q&A process, we're happy to answer any questions our district partners may have.
Yes, sir. Thank you so much, Kevin. So for folks, if you can go ahead and use the Q&A feature. Thank you, Kevin. That was a pretty comprehensive presentation, so thank you so much. But for folks, if you want to go ahead and just drop anything in the Q&A feature, or you can drop your questions in the chat. That's why our partners are here. We still have about 27 minutes left allocated for this webinar, so we'd love to answer your questions.
And while we're waiting on questions, one more thing that I actually did not mention, but it is important, and I think it'll be fixed by Friday. There's a note on the vendor resource chart that says the Binex now is on national back order. That's not the case. We have plenty of access to the Binex now. That test specifically, as many districts already know and have experienced now for quite some time. It's been on national back order for a long time for all parties for the most part. That's not the case. So just to be clear, we can absolutely deploy those. That is a note that you may have seen on the vendor resource chart that is going to be, we've been told it's going to be updated by Friday. But I just didn't want any district to see that and go another direction because they thought that we didn't have the capability for those tests. That's not the case. We can absolutely support any next now request.
So
it looks like what kind of training is required for nurses? Is that the first one?
Yes, sir. That's the first one.
Okay, yeah, it's the one at the bottom. So I didn't want to miss questions above it. So the question is, what kind of training is required for our nurses? Can you tell me the components that are involved? I'll touch on it. Cicely Vega, who's on the call as well, is kind of more day to day and get a little bit more granular. But from a super high level, we've got a training program that we can deploy along with the tests. It includes all the instructions for use. It includes both with the test and the technology. We have the capability to connect in real time to support additional questions after that training. I will say it is extremely user friendly. We have not received a lot of issues on the training itself. It's pretty quick and easy, but let me pause for a second. And Cicely, do you want to add anything to that with any more granularity on the actual training program?
Sure. So like Kevin mentioned, we provide training on our system. If your staff is going to be administering the test, we have some easy steps to follow, as well as like a walkthrough video. I'm also available and have done this many times where I have jumped on a quick video meeting with a district, with their testing coordinator or with their group of nurses, and always happy to walk you through the system as well. But it's pretty seamless once you get into it. It's very user friendly. So we're here to provide whichever support and training method works best for you guys.
Thank you so much, Cicely. The next question is in the Q&A. They're asking about a CLIA. Is the CLIA waiver included?
Short answer is yes.
This is Diane. Can I clarify on that just a little bit, Kevin?
Yes.
So on the vendor resource chart, it states that the school needs to obtain their own CLIA waivers, that Goodside will provide assistance to the schools in helping them apply for that. Now for PCR tests, of course, that's taken care of. The CLIA is taken care of because the lab has to have that. But for rapid antigen tests, the school does have to obtain their CLIA waiver. There is a charge for that, and it is good for 2 years. So if the school has it already in place, then they don't have to do it again. But it may be necessary, and then Goodside would provide some assistance if needed.
Yeah, thanks, Diane. Sorry, I should have bifurcated the two tests there. That's absolutely right. And we do have a process on the rapid CLIA forms that make it very quick and easy. We've filled it out, helped folks fill it out 1,500 times now. So it's not challenging. And then, Diane's right, that the PCR is handled in the labs, and that's pretty customary in general.
Yeah, and for the CLIA waiver, as soon as they hit submit, they'll get an email back that says, this is your CLIA number, and then they're ready to go.
Yeah. And I think that addresses that other question. There were two about CLIA. One was in the chat and then one was in the Q&A.
Okay. Are there any other questions? I'm just scrolling through that I have missed throughout here.
I don't believe so. There's another one in the Q&A feature. Is the cost for the CLIA still $180? Yes. From our knowledge, it still is $180 unless they've changed something. But as we know, it's still $180. Please continue to ask your questions. And while folks, go ahead, Kevin.
I was just going to say, how soon can we order a test is the question. I'll pause because that's probably a TEA DSHS answer more than a Goodside answer.
Yeah.
You guys will communicate the timelines. We
Yeah.
don't do that.
So at the end of this month, within the next week or two, TEA and Dishes or TA will be announcing all of next year's setup with the application launch, which is slated to launch middle to end of July at the latest, early August, and then ordering tests would happen at the end of July, beginning of August. So those specific dates will be announced within the next couple of weeks for the fall and for next school year.
And just for clarity's sake, are we in a moment in time here in June that we're unable to communicate about it? So in other words, tests can't be ordered until later in July, it sounds like, but are we able to interact with the districts for any pre-planning, or is this intentionally a time of dead zone almost between the two semesters?
That's a good question. Can you go further? And Diane, feel free to jump in. When you say pre-planning, go a little bit further. I want to make sure we understand the question.
So I'll frame. I think Diane probably knows it, has communicated. I know this has been a point of communication, not just for us, but in general. But things like how many sites does a district want to populate eventually? Do they need testing? So there's a lot of questions and planning that can go into setting up a partnership that we see all the time, right? Districts that want to deploy testing in a number of different ways. So could we start planning and building a program that works for them, but not making any orders until whenever TEA DSHS says is appropriate? That's kind of what I'm seeking clarification on, so that everybody can hear that as well.
Thank you so much for that, Kevin. I would say that any schools that you worked with last year for the 21-22 school year, you can have communication with them to find out what their plans are for 22-23 and help them with that. And other than that, the schools need to reach, if it's a new school that you haven't worked with, they need to reach out to you instead of you reaching out to them.
And now, I guess is the question, could a school district start reaching out to vendors now to begin the planning, and then wait to actually order the test and order the staff until such time that the program allows for it?
Yeah, they can start reaching out to any of the vendors now and start some pre-planning conversations. And
Hello?